Hello, this is my evidence-based nursing monograph presentation on sepsis. To start off, my name is Michaela Troutman. I chose sepsis because it is seen often within the hospital setting. I wanted to better my knowledge and understanding on the topic and learn ways in which nurses and future nurses can better identify and treat sepsis before the client's condition worsens. I had a 67-year-old male client who had a hip replacement in his right hip in 2017. The hip got infected and turned to sepsis. The client was having severe pain in the hip and presented to the ER. The client was then assessed and admitted to the 6th floor to be treated for sepsis. Assessment findings. With the assessment on the client, it was found that his temperature was 101.7 degrees Fahrenheit. The heart rate was 95 beats per minute, and he had pain in his right hip that sort of shot down his leg. He rated the pain a 7 out of 10 on the pain scale. The client had limited movement and inflammation in the area. The client had a PICC line in his left upper arm and a 20-gauge IV in his right forearm. The client had diagnostic tests done. I found that the client had an X-ray of his hip and inflammation of the joint was present. This could come with infection or sepsis. The client also underwent several blood tests to help identify the specific pathogen that was causing sepsis. Some of the key medications that were administered to my client include IV fluids, hydrocodone for his pain, and antibiotics to help treat the infection. The two antibiotics that I found were vancomycin and ceftriaxone. The pathophysiology of sepsis includes life-threatening organ dysfunction that is caused by the body's response to an infection. Sepsis is very unpredictable and it can be systemic or localized. It is most often caused by bacteria, but it can also be caused by problems associated with viral infections such as influenza or COVID. What happens within the body when sepsis develops is the body lets off immune chemicals that are meant to fight infection. These chemicals are put into the bloodstream, and this causes inflammation. The inflammation then leads to impaired blood flow, and the impaired blood flow causes tissues and organs to not receive the nutrients and oxygen that they need. This could lead to organ failure or septic shock if left untreated. Next, for incidence, mortality, and survival. For incidence, there is 1.7 million people diagnosed per year within the United States. There is an increased risk for individuals who are 65 years old and up. Mortality includes, for each hour that sepsis goes untreated, there is an 8% increase in the chance of death. With that, sepsis was the third leading cause of death in the United States in the year 2021. About 270,000 die a year from sepsis. Surviving sepsis comes with early detection and proper treatment. Having sepsis once impacts an individual's immune system and increases the likeliness that they will get sepsis again in the future. Current practice. There were two main steps in preventing sepsis listed in the monograph, and they were to prevent antimicrobial transmission and infection to prevent infection from turning into sepsis. Preventing infection can be done by proper hand hygiene, cleaning equipment, and using PPE as directed. Early recognition of the signs of sepsis is crucial in preventing it from worsening. Individuals must have at least 2 of the Sears criteria for it to be sepsis. The symptoms include elevated or decreased temperature, tachycardia, tachypnea, hypotension, elevated or decreased leukocytes, decreased urine output, and altered mental status. Early treatment is super important with sepsis. Along with sepsis comes the sepsis bundle. The sepsis bundle should be utilized once sepsis is suspected. Measuring lactate levels, getting blood cultures prior to administering antibiotics, administering crystalloids for hypotension or elevated lactate, or vasopressors for hypotension. Fluids should be started right away. Once the pathogen that is causing the sepsis is identified, the client will actually start a specific antibiotic that is meant to fight and treat the specific pathogen, but until then, they will be on broad-spectrum antibiotics. Monitoring vital signs frequently is also very important. In relation to my client, this monograph relates to my client in a few ways, the first way being the client's age puts him at a higher risk for developing sepsis. The client had a few of the Sears criteria, such as fever, increased heart rate, and he also had severe pain. The client had a sepsis, obviously, and that was identified early. They were able to start the client on antibiotics and get a grasp on the infection before it worsened. The first article that I selected from my monograph was titled Nurse-Directed Sepsis Care. It was Level of Evidence 6, meaning it was a quality improvement project that aimed at the early identification and treatment of sepsis within 1 hour of detecting it. This study was done within a 7-year time frame. The use of the sepsis bundle increased from 40.5% to 73.7%, and the average time for administering medications was 80 minutes from arrival. The number of rapid response calls related to sepsis decreased, as well as the mortality rate. In the end, it was found that the nurse-directed sepsis care encourages early identification and treatment of sepsis, and that the sepsis bundle being used was successful. The second article that I selected from my monograph was titled Vital Sign Alert System to Improve Outcomes. This was a level of evidence 4, meaning that it was a cohort study. The study used a sample of 157 nurses from a hospital, and they were given a survey before and then again after completing education on vital signs and sepsis. There was also a sample of 245 chart audits that were done to help assess the compliance to the sepsis rules for monitoring the vital signs. The results showed that the audits presented a 91% increase of the time in the vital sign alert system. The nurses showed great improvement the second time filling out the survey versus the first time. There was a decrease in rapid response related to sepsis as well as mortality rates. The end result of the study was that the vital sign alert system was successful and helped identify more cases of sepsis. The VSA is effective in presenting clients that could be worsening in condition. Evidence-based nursing. For assessment, it would be important to do a thorough history, understand sepsis protocol, assess for symptoms, monitor I&O, monitor vital signs, assess mental status, and assess capillary refill. Data analysis includes monitoring serum lactate levels and reporting elevated levels to the provider, monitoring blood cultures so that the client can begin antibiotics specific to their pathogen, monitoring glucose levels and reporting levels higher than 140 in clients without diabetes mellitus to the provider, and monitoring leukocytes and electrolytes as prescribed. Any abnormal findings should be reported. Planning and implementation involves following the facility's policy and sepsis bundle and treatment, getting orders for broad-spectrum antibiotics, administering other meds as needed and prescribed, and notifying the provider with any significant changes in the client's condition. For the discharge planning, it would be important to provide thorough education on identifying the early signs and symptoms of infection, to ensure the client knows when to seek medical care, and to educate on the importance of the antibiotics prescribed and that they need to be taken until they are gone. Then the nurse should evaluate the client and/or family's understanding of the teaching. The teach-back method could be used here. Benefits to the client. Ways that this client benefited from things used from this monograph include his sepsis being identified early on. The client was assessed frequently. He had diagnostic work done along with labs. He started antibiotics and was prescribed a medication to help treat his severe pain. He was given IV fluids, and overall the client was monitored pretty closely, all of which are things that were mentioned within the monograph. In conclusion, it is important that signs of infection and sepsis are identified early on. The earlier the better, because treatment can then be started to help keep the client's condition from worsening. Keeping a close eye on the client's condition and lab results would be really important to ensuring that the client's condition is not deteriorating. If nurses continue to follow the sepsis protocols and are able to identify sepsis early on, then there will be a continuation of the decrease in mortality rates in clients with sepsis. Lastly, here's a slide of my references. Thank you.